What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, August 1st, 2024. Welcome to August. Welcome to my channel if you're new to my channel. And if you are new, you have just clicked onto the Daily Pandemic Update. What is the Daily Pandemic Update, you might be asking? That's where we talk about the ongoing COVID pandemic and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. Today we'll be starting off talking about measles. You need to be informed with what's going on with each and every one of these viruses. The news doesn't talk about it very much. Me, I give you 20 minutes of coverage of news and data on these viruses and other things each and every day. Want to stay informed with what's going on? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share these videos with anyone you know. And of course, leave a comment down below. Alrighty, today is a very busy news and data day. We have several things to show you. We have some updates I've made to the website that I want to show you if there's time, because there's quite a few things that we have to get through, so let's get right into it. First off, starting off on the West Coast in Los Angeles, tourist tests positive for measles after flying through LAX visiting Orange County. And I did tweet this out and I did post it on the website, so you can go and check for all the details. I linked to the story, and plus this story will also make a new thread that I'm going to be updating daily and starting daily on my website, which will link all the stories and other things that are used in my update each and every day. Mainly the news stories. I will start linking, and there'll be a link to that daily thread probably in the description of these videos, because I got asked yesterday about that, and you know what? I agree. It's time. If you want to get to these links easier, you can do that, because not everyone's on X, not everyone's on Blue Sky, and I don't always get to post all of this there. Moving on. This is some good news. Nasal COVID-19 vaccine halts transmission. Study in hamster indicates vaccine targeting the nose and mouth may be key to controlling spread of respiratory infections. That's a good thing, because as we all know, the regular vaccines, unfortunately, do not halt transmission. They do reduce the severity of a case that you may have. They also do a pretty good job of preventing deaths. They don't prevent all deaths or prevent all hospitalizations, but the one thing that they do struggle with is transmission, and we've known about this ever since day one of the vaccines, and hopefully this can be some good news down the line. Hopefully we can advance with this, because it seems like we've heard about this before and yet nothing comes of it because of Moderna and Pfizer, or whatever the case may be. Alrighty, moving on now to this. Guelph General Hospital in Canada declares COVID-19 outbreak in one of its inpatient units. So yes, COVID outbreak once again, this time up in Canada. Alright, moving on. This is more of a data thing, not so much news. I just put it at this point in the update. And this is the weekly COVID-19 surveillance report for the state of Vermont, which I happened to come across today by accident. But hey, we haven't talked about Vermont in a while. And they do have here on the chart emergency department visits with COVID-19 diagnosis, and you can see here that at this time it looks like they had 10 reported in the past week. That's a relatively low number, but remember, Vermont is a smaller state, and we can see the COVID variants here. KP.2 shows up a lot, KP.3 shows up, and LB.1 does show up a little bit as well, and we'll see LB.1 again later when we go and take a look at New York State. And we can see here there are a few other variants mixed in. Then there is also an other category as well. Overall, yes, Vermont is rising, but it seems to be the worst area in Vermont is Montpelier. Take a look at wastewater in Montpelier, and you can see here on this chart, it does show that Montpelier is rising. South Burlington and Essex Junction, more so, Essex Junction's dropping. South Burlington hasn't really rose all that much, but it's Montpelier that's doing really bad at this time. And that's relatively interesting, because Montpelier did actually have the biggest wave in the state back in the wintertime, and the other areas were not hit as hard. So you would think that they would get hit harder, but here we are. So we'll have to see what happens here. And I'm thinking Montpelier will probably peak relatively soon, but it's something we will have to keep an eye on. When we take a look at deaths, we can see there have just been 2 deaths reported so far within the past week. Or is this month? It says monthly COVID-19 deaths, so it looks like they may have only had 2 reported within the past week. All right, moving on now to this. Long COVID is hitting Kentucky hard. Vaccinations and proper ventilation are important. We do know that it is important to be vaccinated, and we do know that air quality is key. But let's scroll down to this right here. 7% of all Kentuckians report having symptoms of long COVID, 8th highest in the United States. And we do know the highest is, or at least last when I saw, the highest is Oklahoma at this time. So it's good to know that Kentucky, unfortunately, now has 7% of all Kentuckians reporting at least some sort of a symptom of long COVID. Yikes, that's not a good number. Oregon, seeing a surge of COVID-19 infections, but illnesses, unquote, relatively mild. Yes, they could be mild now, but if you go on to deal with long COVID, that's not mild because, it really disrupts your life when you deal with long COVID. Because not only do you have to go to more doctor's appointments, you have to go to specialists, then you have a lot of questions with not always easy answers because, let's face it, there's not enough research being done on long COVID. Yes, the word mild, yes, if you're in acute infection at the time you test positive is mild, fine. But if you go on to develop long COVID, that's not mild because you have the financial problems that come with that. You have to take time off work for more doctor's appointments. You get tired, all the potentially different symptoms. There's a lot of things that happen. I hate when they say the word mild. All right. Oregon is reporting that their test positivity rate for COVID is 14.8% of their COVID test. A significant increase from spring. Well, we know that. Oregon's been dealing with a surge on the West Coast. The hope is that they will be dealing with a relatively quick peak relatively soon, and I think they have been peaking. We'll take a look at Oregon today on Walgreens. I'll pull that up if we can. It may be one of the states that did not report. Alrighty, moving on to this. COVID-19 pauses Outer Cape entertainment. 2 venues canceled a week of performances in July. That's right, entertainment. It's still getting hit by COVID. Providencetown, 4 years after COVID-19 brought live performances worldwide to a halt, the virus is still working its will on Outer Cape arts venues. The Wellfleet Harbor Actors Theater on July 20th canceled its remaining shows as Reefer Madness, which had been scheduled to run until July 27th after 5 members of the cast and crew tested positive for COVID. 3 were asymptomatic. Then you come down here where it says that same week the Providencetown Theater canceled 4 performances of the Rocky Horror Show because of COVID. The production resumed on July 29th and is expected to run through September 5th. COVID, yep, still wreaking havoc on entertainment. Alright, taking a look at the site today. You can see I've added several different things. We've updated the Summer Olympics thread. There'll probably be another update coming later on. I think there may be some more stuff to add. That's why I haven't showed it today. Maybe we'll take a look at that tomorrow or Saturday. And we did add this now, a new thread about heat-related deaths. And the first post, unfortunately, has to deal with Nevada, where Las Vegas had 60 deaths in Clark County. It's been a very hot summer across many places around the country, and that is really causing problems at this time. All right, in the U.S. general discussion, or somewhere within this area, there's going to be a new thread that comes, and that's going to be a thread where I post the daily news stories that I share on the Pandemic Update. So if you want to look for those news articles that you're seeing on here, you'll be able to find that there, and it's going to be coming relatively soon. Alright, moving on. The United Kingdom did update today, and they report just an increase of 8 cases. It says here 3,625 cases have been added, no update to deaths or healthcare, and as of July 20th, their positivity rate is at 15.8%, and we can see here on the chart that they're still at elevated transmission, though a lot lower than they were last year in the summer and last year in the winter time, but they are still elevated and they are not yet dropping, despite the fact that it does seem like things have leveled off. So maybe within the next few weeks, we'll see a drop in the UK. One can only hope. All right, moving on now. National allergy map. 50% of the country is in medium status. Taking a look at air qualities for today, we still do have places around the country that are having problems with air quality. Really bad day for air quality along the I-95 corridor in the east, where it is very hot today. I'm looking at my weather station. It's 96 degrees outside here. At one point it was 99 degrees. Wildfire is still a problem out west, which is leading to problems in Oregon, California, Washington, Nevada, and so on. Still dealing with air quality problems there. Heat-related illnesses, we just mentioned that. Here's the nationwide look at that. And scattered issues throughout the country. Some places are doing worse than others. You can see up in New England. Yes, there's a lot of heat-related illnesses there. It's been very hot, and not as many people have central air conditioning up there, which can also be a problem as well. Alrighty, moving on. Want to learn more about the weather and climate? Climate Data Report over on X is the place to do that. And now moving on to Philadelphia. Philadelphia reported another 840 EMS incidents for Wednesday, July 31st. Taking a live look at what's going on in southeast Pennsylvania in Montgomery County, we can see there are currently 13 EMS calls at this time. And in Chester County, we can see there are a few calls, including sick person, heart problem, and a couple strokes at this time. Not good to see more than one stroke at once. Pennsylvania did give an update today to the wastewater for COVID, and we do note that up near the Wilkes-Barre-Scranton area, there is a large increase up in Lackawanna County. There are some increases continuing in the Harrisburg Capital Region, York County, Dauphin County, and Cumberland County, and there is also an increase at this time in northern portion of Allegheny County, and things remained level this time in southeast Pennsylvania with no change being reported. All right, Walgreens this week. Taking a look at the national positivity trend, it is at 39.4% for COVID. That is down slightly from last week, 39.6% last week, down by 0.2%. And the total test, 8,132 versus 7,637. And can we take a look at Oregon? No. Oregon's white, so that means you can't check because nothing was reported there. All right, Canada for today. Let's refresh this. Canada's COVID viral activity level is moderate. The flu level is low at this time. The viral activity level of flu B is low, and RSV is low at this time. All right, let's take a look at one wastewater site for today. I actually did a tweet about this earlier, and I thought this was really interesting. So remember, when Hawaii was rising for COVID, Honolulu, they did have a really big surge for COVID. Then they started to drop, and they did, through to about July 7th. Then they leveled off and rose a little bit again post 4th of July. Now they're gradually, well, we'll say slowly dropping once again. No, gradually dropping once again. Perhaps maybe this is an indicator of what could be to come for the rest of the country post-summer surge. Some areas are peaking now. Some will peak a little later. It's really different region by region, but this is a good indicator of what's happening post-surge in Hawaii. So good to see that Hawaii is continuing to drop some. Would like to see them drop faster, but let's face it, we're not going back to the spring levels. We've already seen our lowest levels of the year, not only in Hawaii, but all around the United States. Moving on now, taking a look at what's going on in New Jersey for today. New Jersey reports 487 hospitalizations. That is down slightly from yesterday. 9 people are on a ventilator. In the ICU at this time, 37. And discharges, 74 people are discharged in the last 24 hours. New York State. Some really good news here. New York State cases are lower than last Thursday. 2,678 cases have been reported today. Looks like last Thursday's report had 2,879. But I do express caution. This is something I'd like to point out all the time. Don't always think, oh, just because a region, a state is peaking, things are safe again. No, transmission still remains high, and there's even a few smaller locations within New York State that are still seeing rises. For example, the hospitalizations in New York State for today, as you can see here, they did go up a little bit. There's multiple reasons for that. First off, the number of people hospitalized is 1,177. In the ICU, that's now up to 121. Remember, hospitalizations lag the peak of cases. They will happen a bit later, but there's another reason why it went up today. First off, New York City. Let's take a look at that. New York City at this time, it will come up here. New York City at this time is seeing things drop a little bit. You can see New York City, 513 hospitalizations, 60 people in the ICU. Let's take a look at Western New York. You can see Western New York dropped a little bit, 32 people in the hospital, 7 in the ICU. But then we come down to the southern tier. Well, look at this. The southern tier within the past week has just started rising. And really, the past 3 days, they have really rose big time. I mean, they started the week at 18, then it went to 20, then it went to 24. Now they're up to 30 people in the hospital and 1 person in the ICU. So you get the idea here. There are some regions in New York State that are still rising. We take a look at the Mid-Hudson. You can see there's a little bit of a rise there. 149 people in the hospital and 10 people in the ICU at this time. And let's go up to the capital region of New York State and see what's going on there. That did see a rise today as well, after it was starting to drop. 55 people in the hospital, 7 people in the ICU. All right, real quickly, New York City, I wanted to show you this. The LB.1 variant, that's the variant that is leading the way in New York City. Hopefully we will get an update on their variants in the near future to see if KP.3.1.1 does become more prevalent there. Taking a look at this for Washington State, 2% of the emergency department visits are for COVID. 2% of hospital admissions are for COVID. It does say that's down by 22%. 17 people are in the ICU for COVID at this time. All right, here's something we haven't looked at in a while, and that is Indiana. Indiana did update on July 30th of 2024. You can see here on their charts here, they do compare year to year, like hospital admissions, emergency department visits, and it does look like they do seem to be riding lower than they have been in previous years. Then when we come down here, we do note here's their wastewater. I guess this is the statewide average. Of course, it starts refreshing on us. Here we go. Statewide wastewater sample collection. And it does clearly show here that there is a rise in wastewater in Indiana. And the most recent case number that I'm seeing is 1,782 new cases in Indiana. Here's Virginia. We showed you this earlier in the week. And Virginia, it says cases by date of illness. This was the 21st through the 27th. They reported 5,848 new cases. And I do believe that is all we have for today. We covered quite a bit today. So I hope you enjoyed this update. I hope you were informed with what was going on. We tried to get to Ohio today, but at the time of recording this, I did not see any new information for Ohio. I'll try and include it tomorrow, which tomorrow will be a big update. Tomorrow we get the new variant information. And you know what, real quickly, let's take a look at that. KP.3 is at 32.9%, and KP3.1.1 is at 17.7% as of today. Tomorrow these numbers change. We'll have to see how much further ahead KP.3.1.1 gets. Don't be surprised if it does overtake KP.3. It's going to be close. If it doesn't do it, it's going to be close. It's projected to eventually do it. We'll have to wait and see if tomorrow's the actual day. If you enjoyed this update, give it a thumbs up. Want to see more content like this? Subscribe to my channel down below. Hit that notification bell. Share these videos with anyone you know. And remember to leave a comment down below. And of course, if you want to find anything about COVID or anything else, the Olympic tracking thread, datareport.info. You can see that right up here in my address bar. Datareport.info is my website. I'm constantly updating that daily. Yeah, I've updated a lot of stuff today with more stuff to come before the day ends. And remember, somewhere on here, I don't know where precisely it's going to be, I'm going to be starting to share all the stories in one thread or in some sort of a thread from the daily update. So any news story you see in the day's update, it will be posted there so you can find a story and read the full story yourself. Because remember, we don't always read the full stories because, well, if we did, these videos would probably go an hour long if I sat during the video reading to you the full story. Alrighty, folks, that does it for today's pandemic update. I will see you all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.